My mission is to bring entrepreneurs and nonprofits a voice, and I'm very excited to have Dr. Van on today. And he is with New Jersey Regional Eye Care here in Ramsey. Welcome.
Thank you very much. Thanks for joining us today.
Yes.
Into the office. It's
I know. We're live in his office in Ramsey, so this is awesome to be here. Thank you for inviting me.
It's a pleasure.
Being a part of the show.
Cheers.
Absolutely.
Mm-hmm.
So I'm excited to hear about you and your offices, and maybe we could talk about your partners, the other doctors in the office, and a little bit of your roles. We'll start there.
Yeah, I'll start at the beginning. We started in practice in Ramsey. I started in 1996. I joined a doctor who had been in practice here for many years. His name's Dr. Denby. And I joined with him in 96. I grew up in Allendale, local guy. I've been in here my whole life.
Yeah, I was going to talk about it. All the doctors are local. They're all Jersey guys.
Yep.
Girls too.
So I started in 96, and we were over on Main Street in Ramsey across from the high school. And over the years, my partner that I started with retired. And then my one associate now, her name's Megan Bruther. Dr. Bruther joined with me in 2004. And we worked together for about 8 years. She went on maternity leave at that point and had two beautiful twins.
All right, awesome.
And then my second associate, Dr. Robin Hauk, who is a Ramsey native, went to Ramsey High School. She joined with us in 2012, and we learned quickly that we were running out of space in our office with the three doctors there.
Yes.
And thank God we were getting busier and busier over the years.
That's wonderful.
Which is a good thing.
Yeah.
So we actually built a new office building in the same town here in Ramsey. We're right on the corner of Franklin Turnpike and Route 17.
Yeah, it's beautiful. The offices are beautiful.
Thank you very much.
Yeah.
We worked hard on it.
Yeah,
Very
absolutely.
proud of it.
Yeah.
But we moved in here almost 2 years ago now, the summer of 2015.
Wow.
So it was a nice transition, but it allowed us to expand quite a bit and modernize, and technology-wise is always expanding and getting better in our field and all the medical field, and it gave us a great opportunity to get to a new space.
Yeah, you were saying that everything's state-of-the-art here.
It really is. We work hard at the technology is always moving and it's always changing, and it's one of those things that we gotta work hard at helping get an excellent diagnostic capabilities and helping also give patients a good experience through their exam process and give people better vision. That's our whole goal,
Yes, and thank you. I had a little exam before
we
started because, unfortunately I'm not able to read very well now.
The arms are not long enough.
Exactly, they're not long enough anymore, so yes. So I thought I'd be responsible and not just keep getting readers and get the right ones.
And everything was fine.
And everything was fine. He's wonderful. And everyone that works in the offices, they're wonderful to be around. Your team is really great.
We really work hard at that. I am lucky to have such a fabulous office staff, and most of the staff that's with me, we've been together for 10, 15 years. We do not have a lot of turnover, and we're just a family here, and that's something that we work hard to give that feeling in the office, so that when patients come to see us, they really feel comfortable and they feel like it's a sort of a family / old-time doctor environment,
Right, and I think that's important. You're not a number.
Absolutely. You mentioned to me earlier about people sitting for hours in a waiting room for
because that happens when you go to a doctor's office.
And we really work hard at making the exam process pretty streamlined and smooth, but making sure it's a pleasant experience for our patients.
Right.
I want that to be a priority here.
Well,
people feel it when they come here. They notice.
Well, I felt it, so it's been a great experience for sure.
Good.
So tell me, so you have 3 doctors.
Yep.
Can you give me a little bit of their background and what exactly they do here?
Sure. Dr. Bruther and Dr. Hauk are both optometrists, so they're trained to treat medical eye conditions as well as give examinations of all kinds. The only difference really with the training nowadays in this field is they're not trained to do surgery.
Okay.
So I am an ophthalmologist, which is a doctor that's trained through medical school and is trained to do surgical procedures as well.
Okay.
So for our practice, we sort of delegate a little bit our responsibilities of what type of examinations each doctor does.
Right.
But in general, we all share in sort of the routine care of all of our patients, but the more medical conditions and the surgical care in the practice is handled by myself.
So you were talking about surgeries, and there's several different surgeries that you handle. Can you tell us what those are?
In general, what we gear towards here is vision corrective surgery, and there's several forms of that. What my main area of specialty is cataract surgery.
Okay.
And cataracts, very common problem. I mentioned to you before, everyone gets a cataract eventually.
Yeah, I didn't know that everyone did.
It's a natural aging process of the eye.
Okay.
And inside your eye, like a camera, there's a lens that makes your eye focus.
Okay.
And as we get older, that lens just starts getting cloudy and hazy.
Yeah.
So you're trying to see through that lens. It's eventually like you're looking through a dirty window. It makes the vision get hazy, cloudy, and it's a gradual process, so it kind of sneaks up on people over the years.
Okay.
And because it happens in both eyes, and both eyes kind of gradually are getting worse, a lot of times people don't realize that they're starting to lose their vision.
Right.
And it can happen at any age. I mean, naturally, the older you are, the more likely you're going to have that, but some people get cataracts younger. So the way we treat a cataract is we remove it. We do cataract surgery, which nowadays is very common, very safe surgical procedure, but it's a procedure where we remove the natural lens of the eye that's all cloudy.
Yes.
And we replace that with a new lens. It's called a lens implant.
Really?
And that new lens goes into the eye, stays there for the rest of your life, never needs to be changed.
Okay.
But it's nice and clear. So
Right.
you regain that clarity of your vision again. And the technology aspect of it nowadays is that these lens implants are becoming so precise that they can correct your vision and your need for glasses, and even for the need for reading glasses.
Right.
So when people have cataract surgery, very commonly nowadays, they don't need to wear glasses anymore. So that's a huge benefit of the surgery.
Right.
And there's different ways we can do it, and different ways that different types of lenses that can be used. But a lot of people going through that type of procedure, their goal is not to have to deal with glasses anymore, and we can achieve that nowadays,
Wow.
which is great.
So at what point do you need the surgery?
Well, that's an interesting question. I always say to patients, there's never a time you have to have cataract surgery. You know, if someone has bad cataracts and their vision is declining, it's never going to harm you. It's never going to cause any damage. But eventually, you just lose your vision. You just keep getting worse and worse vision.
Right.
So cataract surgery is an elective procedure, and so we do it when a person gets to the point that they feel like they're just not comfortable with their vision anymore.
Oh, okay.
And most people realize it more like night vision,
Right.
driving at night, glare from car headlights getting worse, or not seeing distant street signs. Or the other thing they realize is reading for long periods, even if you're wearing reading glasses, and just feeling like your eyes are getting tired, like you just can't comfortably read for long periods. Those are pretty typical
Okay.
symptoms that people have. But a lot of times people just kind of gradually lose their vision over the years, and they don't really realize it because it's such a slow, gradual process.
Interesting.
And this is one of the reasons why we really encourage people once a year to have a good eye exam, especially once you get over the age of 50 or even 60, that you should once a year get a checkup, because a lot of eye conditions can sneak up on you.
Interesting.
Yeah, so that's one of them.
Interesting. So one of the other surgeries is Lasiks surgery. Yes.
Another very common vision corrective surgery.
Yes.
Yeah.
Yes. And I think people are interested in it.
That's something also that we do here regularly. LASIK surgery, a little different than cataract surgery. LASIK is a procedure that also is meant to correct your need for glasses, but it's mostly geared for distance vision, and it's mostly geared towards younger patients.
Okay.
So for example, if somebody was developing a cataract or at the early stages of that, we really wouldn't consider them a good candidate for LASIK, because then they're going to develop a cataract and they'll need cataract surgery,
Right.
Which we can correct the vision with. So LASIK would be more for younger patients that wear glasses and either don't want to wear glasses or don't tolerate contact lenses because of things like dry eyes and that sort of thing.
Okay.
But that's a procedure where we use a laser to reshape the surface of the eye, the cornea.
Yes.
And people that are very nearsighted or farsighted, their corneas can be reshaped with a laser, sort of like using a lathe to reshape the surface of the eye, and that in turn, to a very precise degree, will correct the prescription.
Okay.
And therefore they can function very well without glasses afterwards.
Wow, that's I mean, me personally, I had it several years ago.
A long time, and you said it lasted you for many, many years.
Right, so it was about 17 years ago.
It's fantastic.
And I still, you said I still have 20/20.
Yeah, still 20/20 in both
Yeah.
eyes. So the great thing about these procedures as well is that by and large they're done for your life. You know, so once they're done, they stay very stable over many, many years.
Well, great. So there were a few other things, glaucoma.
Yeah, a lot of different eye conditions that we take care of here. Glaucoma is a very common sort of aging eye process where the pressure in the eye builds up and gets too high. So your eyeball basically is filled with fluid, and there's a system that produces the fluid, and there's a drainage system where it drains out of the eye. But as a person gets older, that drainage system can get a little clogged up, and then the pressure can start to build up within the eye. Also one of these conditions that sneaks up on you because it doesn't hurt, you don't feel it, you don't know you have it. And the dilemma with that is that if that pressure stays very high in the eye, eventually it can really damage all the structures within the eye, and it could lead to blindness.
And I'm sorry, how would you know?
You wouldn't know unless you had an eye exam, exactly.
So that's why it's so important to have an eye exam.
Another reason why. And glaucoma also, you look at a lot of these issues as if they're really problems of the elderly, but they're not necessarily. You know, younger adults can get glaucoma too. A little more risk if it runs in your family or your mom or dad had it, but not always. You know, sometimes it's something that develops.
And another thing was molecular degeneration.
Macular degeneration. Yeah, that's a tongue twister.
Excuse me, macular degeneration.
So macular degeneration is a problem a little deeper within the eye with what we call the retina tissue. We always liken the eye to a camera. The retina is sort of like the film inside a camera. And it's sort of an aging process where the retina tissue goes through degenerative changes. And that can start to deteriorate the vision. Macular degeneration classically does affect the elderly, although there are forms that could affect younger adults. But usually it's more of an aging process as people age, and it very classically affects your reading vision. So people that have macular degeneration, they have symptoms of losing their ability to read and focus comfortably, or sometimes when they look at things like print on a page, it looks distorted or wavy.
Interesting.
And also, unfortunately, a condition that can sneak up on people, and they don't necessarily realize that they're losing their vision. Or sometimes these issues can affect one eye and not the other, so that the good eye compensates, and they don't realize one eye is getting worse, because people don't do this a lot. You know, realize one eye is giving them trouble. So again, a good reason why we promote good healthy eye exams, even if you feel like you're doing fine. Yeah.
Well, and I think it is something that people put off.
Yeah, right? like going to the dentist.
You said, yeah, but also, you know, when I was just having my eye exam, I thought both eyes were the same, and they're not.
Yeah, they're a little bit different.
Yeah.
Right? And most people, now it's natural that most individuals may have one eye that's a little different than the other, and if you really sat and compared them, it's sort of normal that you'd notice maybe a little difference between the two eyes. Most people are like that. Everybody has one eye that's more of a dominant eye, so to speak. But a lot of times it changes and you don't even know it.
Interesting.
And you go to the doctor, and we've had it almost on a daily basis where people come in, we examine them like, wow, I didn't realize that, you know? And usually it's something we can make better though.
Another very interesting thing that you shared was through the eye exam, about the blood vessels in the eyes and other things that you can detect.
Yep. The teaching is sort of that the eyes are the windows to the body, and the window to the health of the body. And what it means is that a lot of medical conditions, things like diabetes, hypertension, conditions that affect your body, they'll affect the blood vessels within the body.
Right.
And when we look inside of the eyes during our examinations, that's the only place in the body where you can actually look at and visualize blood vessels.
Unbelievable.
So when we examine the eyes, we look at the health of the blood vessels within the eyes, and that gives us an idea about the health of the blood vessels throughout the whole body.
Unbelievable.
So, you know, conditions like diabetes, if it wasn't well controlled, or high blood pressure, it's not common that we would actually diagnose these conditions by looking at the eyes, but we can at least get a feeling for how well things are controlled, or if they're not really well controlled, by how it's affecting the body and affecting the eyes.
Right. Interesting.
Gives us a lot of information.
The other thing, vision corrective surgery. We didn't talk about that.
Well, we went
A
through
little
a little bit
bit,
about the LASIK and the cataract surgery.
But what else? Is there any other?
Well, those are the two mainstays. There's other types of corneal procedures for people that have different types of astigmatism or certain eye conditions. One particularly called keratoconus, which is an abnormal cornea condition. They're less common, but there's different surgical procedures that can be done for those. But in general, LASIK and then lens implants with cataract surgery are sort of the main vision corrective type of surgeries. Now, the other options for people are things like contact lenses, glasses, these types of things, which we do regularly here at our office. Can help people that don't want to necessarily pursue a surgical correction, but maybe you're not happy wearing glasses or not full-time glasses. There's definitely different options out there besides having to have surgery.
Are any of these things done here in the offices, these surgeries, or where are they done?
No, not normally. We do minor procedures here, like, for example, if people have, you know, eyelid lesions or skin tags or little things that need to be surgically removed, we do that in the office. But our cataract surgery we do at a surgical center, which is down in Elmwood Park. It's called River Drive Surgical Center, but it's just a state-of-the-art eye facility. All we do is eye surgery there. And then our LASIK surgery, the laser vision correction, is also done at a separate laser center. But we don't do them here at the office.
And what about, my husband had issues with his tear duct, so that created an issue, and they said if he had not corrected that, it could have led to worse problems for his eyes.
There's a whole litany of different potential eye issues. The eye seems like a minor thing, but it's a very complicated piece of machinery, and there's a lot involved. Conditions like the tear ducts, the sinuses, dry eyes is a real common condition that people deal with, and these are all things that are treatable, but if neglected or not taken care of, they can often lead to a lot worse problems.
And you know this because of dry eyes, or are your eyes itchy? Like what?
All differently. Dry eyes are typically going to give you more like red eyes, burny eyes, sometimes just sort of tired eyes. Probably the number one symptom of dry eyes is tearing. And it's kind of weird because people think, oh, by the end of the day, my eyes are tearing all the time. They come here and say, oh, you have dry eyes. I say, how can my eyes be dry? They're always tearing all the time. But the only reason your eyes tear is because they're irritated. And so there's something irritating them. We've got to figure out what that is, but oftentimes it's because they're dry. And people start using eye drops regularly to moisturize and soothe the eyes. And all of a sudden the tearing stops. They're like, wow, my eyes don't tear anymore. You know, so that's a common thing that we see.
That is interesting.
And allergies, that's a whole other ballgame. But all allergies,
for goodness
this tis the season, right? The pollen's out, the cars are turning green. But allergies more just itching. That's the main symptom there. You know? So we always are distinguishing when people have come in with red, irritated eyes. The first question is, does it itch or does it burn? One or the other. Like it's either dry, or if they're itchy, it's almost always allergies.
Always allergies.
And this season, we're getting bombarded with that. It's just getting started.
Absolutely. Yeah, I mean, I've noticed it myself coming up, so starting.
It's just getting started.
Yeah,
some people get allergies all year long, though. You know? Indoor allergies, dust and molds and all that stuff.
Those dust mites that are all around us.
We have, there's good medicated eye drops and different things that you can do on a daily routine to quiet all that stuff down and keep it under control. Right,
and you were telling me also about some eye drops for dry eyes.
Yep, just good over-the-counter eye drops. We always tell people stay away from any of the get the red out eye drops.
Oh, interesting.
So things like Visine and Murine, those things, if they say like they get the red out, there's chemicals in those eye drops that actually, if you stay on them, can actually make things worse. So we always recommend to people using what we call artificial tears, which is just like sort of a saline, you know, it just moisturizes the eyes, rinses the eyes, and you can use them several times a day, and they don't have any side effects. But it really helps as far as making the eyes feel better, getting rid of the allergens in your eyes, that sort of thing. Your eyes and your eyelashes tend to attract all this stuff all day long, and you want to get that stuff away from your eyes to keep them healthy, keep them comfortable.
I want to ask you, speaking of all that, if you get something in your eyes and then they say, you know, just wash it out.
Yeah.
Should you go to the doctor? Should you?
Well, not necessarily. I mean, you know, this is where those artificial teardrops are great.
Okay.
And obviously, it depends on what it is that gets in there. But you know, it's often you get an eyelash in your eye.
You know, when I get bleach in my eyes.
Bleach is different. A splash of bleach in your eye, you ought to get on the phone and get in here. But yeah, no, if you what typically happens if you get something in your eye is it can scratch your eyeball.
Right.
And so then you rinse it out, and the particle isn't there anymore, but you still feel like there's something in your eye. And this is typical. We see people like, I got something in my eye 2 days ago, it's still bothering me, then they come in.
Right.
So, I mean, if you rinse your eye out, if something like that happens and you feel fine and it resolves, great. But a lot of times you'll scratch the surface of the eye, and the cornea, the surface of the eye, is just intensely sensitive.
Yeah.
I'm sure everybody knows that if you get poked or something like that.
Right.
But if you scratch your eye, then it leads to the whole potential of bacteria getting in there, maybe get an infection. Things could sort of get amplified very quickly with problems.
Right.
So, you know, if something ever like that happens, give it a couple hours a day, but if it's still bothering you, it's always better to just get it checked and prevent any kind of worse problems that can settle in.
I know, unfortunately, some people, women, when they put on their mascara,
that's a common thing. The mascara brush just scratches the eye.
Exactly.
It's a common thing.
Yeah.
But you know, usually it's a minor thing, and you get on a little, you know, medicated eye drops or something to soothe it or to prevent infection, that sort of thing. And those things usually heal pretty quickly and safely. It'd be rare that it would leave any kind of long-term effect.
Wonderful. So I want to talk about Affiliate Optical.
Quality Optical.
Quality. Yeah, Quality Optical.
Yeah,
I'm sorry, that's the name of it. Quality Optical.
Yeah, so we obviously, as eye doctors, we do a lot of routine examinations, and people come in that just need glasses, contact lenses, those sort of thing. But we have a beautiful optical facility in our building downstairs on the lower level. It's called Quality Optical, but they just have a wide array of glasses, frames, and different price ranges and price points that are affordable for everybody.
Okay.
And the optician down there is outstanding. His name is Bruce, and he's been with me for 21 years now, and been in the business for over 30 years. And it's very important when it comes to getting glasses that you go to a good, reputable optician. You know, there's a lot of these Route 17 places, we call them, where they make poor quality glasses, or it's where the kids go to learn how to make glasses out of school, that sort of thing. Not necessarily where you want to go and get your glasses. You want to go to work with somebody who knows what they're doing. And you don't end up saving a lot of money at those places usually. That's usually their draw, but they can get you sometimes. So you got to just be a little careful with that. But we have a beautiful optical shop here, and we like to look at our practice as kind of one-stop shopping. You know what I mean? We want to give great care. We want people to have a great experience, but we like to offer the optical as an option for them here as well.
People like that.
Yeah, keep it all in one location.
Exactly. Keep things simple. Yeah. Another thing I want to talk about is children. Really, at what age should you start seeing an eye doctor?
Yeah, usually the pediatricians are pretty good about doing eye screenings.
Yes.
With the younger children. We see children here and infants at any age.
Okay.
But in general, we recommend the first good full eye exam with an eye doctor about when the kids are getting into the school systems. So, you know, roughly about the age of 5 or 6.
Oh.
And because before that, the pediatricians are doing a pretty good job of screening. But that's assuming that they're not having any kind of visual problem or any kind of difficulty. Commonly with children, they may have what we call a lazy eye, where the eye muscles may not coordinate well together.
Okay.
Or sometimes even at that age, the kids might be showing you some sort of signs that they're having trouble with their vision. They squint a lot to see things far away, or you know, even you're noticing them at home not really doing something visually that seems right, and by all means get them in and get them checked, make sure there's nothing abnormal going on there. But just for routine exams and checking for glasses and that sort of thing, usually about when they get into the school systems, the age of 5, 6, 7 years old, that's when kids start to need glasses often. And children don't complain about it. If they're having trouble seeing, they don't realize it.
They don't really realize it.
And a child can see things blurry or have trouble seeing the board in front of the class. They don't use blackboards anymore.
Yeah.
But
smartboards
now. But they don't realize that they're having a problem or that it's an issue. And one of the most rewarding things that we see here in our practice is when you have a child or a young adult that needs glasses, they don't realize it, and when they put them on for the first time, it's like, wow, they can't believe what they're missing. And you see, like, it's amazing.
And really, I mean, when it comes to any work, maybe when their grades maybe are faltering, that might be part of the issue.
And sometimes in school, they'll just end up sitting in the front of the classroom because they're more comfortable with it. They don't realize, that this is indicating a problem. You know?
Exactly.
So we get it checked, and say a lot of kids aren't really happy when they're told they need glasses. But nowadays, glasses they've become very fashionable, and just like kids never used to want to have braces, but now they all want them.
They do.
Love it. I know.
There's those rubber bands, and
glasses
oh my goodness, all
thing.
these colors, and
and for kids that need glasses and don't necessarily want to wear them, the option of contact lenses is always there.
It's available.
We usually get kids into contact lenses about the teenage years. Some kids are mature enough to handle that a little bit younger.
Yes.
But contact lenses are kind of a maturity issue, and are they able to put something in and out of their eye and clean them and take care of them?
I still don't want to put something in my eye.
I know, a lot of kids don't want to do that, but for kids that are active in sports and that sort of thing.
Well, the contacts, and then also I've seen the kids with the glasses that
like sports goggles, that sort of thing. Yep. We supply it, but contact lenses, I think, are a little bit more geared towards those kids that are really into athletics and stuff like that, because then they don't have to worry about it getting hit in the eye or anything like that.
Absolutely. I also wanted to talk about a little accolade he's been given from Bergen Magazine. You got that over there. So I want to show it. He would not show it himself, but I wanted to bring it up here. So this is very cool. So 2017.
This was an honor. I was telling Marci earlier that I had no idea that this
it's pretty cool.
came out. One of my patients came in, I saw your name in Bergen Magazine, but Bergen Magazine does a huge survey, I think, of fellow physicians and people that live in Bergen County, but in each specialty area ranks doctors and gives them honors, and I was one of, I think, 6 or 7 ophthalmologists in all of Bergen County.
Wow, that's huge.
And it's nice because it's coming from your peers and from patients that have been here and given you a nice positive feedback. And it was an honor.
That's wonderful.
Yeah, it was nice.
So tell us again, one more time. You've been in practice now how long again?
It's scary to say this is my 21st year. So I started in practice in 1996 in Ramsey.
Okay.
And been in town the whole time.
That's fantastic.
It's really been great. It's been quick.
And now you have this beautiful state-of-the-art office that's here right on 17. Tell us exactly where it is.
Yes, it's actually on North Franklin Turnpike. It's right across the street from the entrance into Interstate Shopping Center.
Okay.
It's on Route 17 South, but you can't access it from Route 17.
You can't?
So, no, you can't. You can't get in from Route 17. You have to come from Franklin Turnpike to get into our parking lot, although you can see our building from Route 17 as you drive by.
And so and 3 doctors.
Dr. Bruther, Megan Bruther, Dr. Robin Hauk, and myself.
And you are the surgical doctor, the medical doctor here.
Again, the Dr. Bruther and Dr. Hauk treat all eye conditions, all medical conditions.
Right, so you could see any of the doctors here.
And they are both fantastic. Their training is second to none. They're both outstanding doctors.
Right.
And we work great together. It's a good team here.
That's
and
great.
Our staff as well, like we mentioned before, is just everybody's been in a group together for a lot of years now, and it's just a real comfortable environment. environment for people.
Comfortable family atmosphere. They get you in. They don't make you sit around in the waiting room for a long time.
Do not. Yeah, we work on
Yeah,
that all.
so really a great group here.
I'll throw it out there. Our address is 284 North Franklin Turnpike in Ramsey.
Wonderful. And we'll put up the website also.
Okay, great.
If you want to just tell the website here.
It is www.njeyes, so it's njeyes.com.
Easy enough.
Yeah, so
No
please feel
problem.
free to get on the website and get some information on there. We have a lot of informational stuff on there about medical eye conditions and treatment options and that sort of thing. And there's a link on there that you can contact us via email. People
Okay.
have questions or want to
That's
get in touch
fantastic.
with us, they can do that right through the website.
So is there anything you'd like to leave us with? I mean, I know get in and get your eye exams.
Yeah, I mean, I appreciate the opportunity to talk with you
Oh,
today.
God,
and
this is
it's
wonderful.
been a pleasure.
I've learned so much.
Good.
Thank
you. And in that vein, it's just sort of our goal here at New Jersey Regional Eye Care to educate people when they come in. You know,
Yes.
we don't just give an eye exam. Here's your prescription. See you in a year. We like people to understand, you know, what their conditions are, what their options are for treatment, and if we do go through surgical procedures or treatments, make sure that it's a real pleasant experience for the patients with an excellent outcome. That's the goal always.
Right, wonderful. Well, we like that.
Always.
An excellent outcome here. Well, it's been such a pleasure. Thank you
Marci.
so much.
Appreciate it.
Wonderful.
Hope you enjoyed your coffee. I
Oh,
know I did.
enjoyed my coffee. All
Good.
right, guys. So have a great weekend.
Cheers.
We'll see you on Monday. And cheers to you,
Thank you.
Dr.
Have a
Van.
great weekend.
All right, guys. Bye-bye.
Bye.